Good evening, everyone, and welcome. My name is Layara Powell, and we're super excited to have you join our session this evening. My name, again, Layara Powell, serving as the Associate Director of Recruitment for our Doctor of Pharmacy program. I'll have my supervisor go ahead and introduce herself, and then we will have our guest speakers introduce themselves, and we'll jump right into tonight's session.
Welcome everyone for coming. My name is Christina Rose. I am faculty and the Assistant Dean of Admissions at Temple School of Pharmacy. And we're happy that all of you can join us tonight for this excellent panel. And I'll let our two esteemed guests introduce themselves. Dr. Hauser, would you like to go first?
Yes, my name is Deborah Hauser. I am the Chief Pharmacy Officer at Temple Health System, and I'm actually a Temple University School of Pharmacy alumni, class of 1990. I've been a pharmacist for 35 years. It's remarkable how fast that went, but I'm delighted to be here, and I thank you very much for inviting me. So a little bit about myself on the previous slide. I actually started my career. Initially, I went to Temple School of Temple undergraduate. I pursued a biology degree at the College of Arts and Sciences. That was in the late 80s. And then I actually went to pharmacy school at Temple University School of Pharmacy, and I graduated in 1990. And I started my career actually as a staff pharmacist at the old Germantown Hospital. Germantown Hospital took care of patients in the Civil War. I mean, it was one of the oldest hospitals in the city. Unfortunately, over the years, it closed and it became a different type of healthcare organization. And I transferred to Einstein Medical Center. And that's where I started working sometime, I guess, in 1999. I started working at Einstein Hospital. I was assistant director, and eventually I became the director of pharmacy. And it was at Einstein that I really developed my career and grew, as a pharmacist substantially. I was able to start a pharmacy residency program and develop clinical pharmacy. Believe it or not, clinical pharmacy was not always part of the world of pharmacy, but it was something that started predominantly, I would say, in the early 1990s. It became really a substantial part of pharmacy practice. And then over the years, I got much more involved in developing other pharmacy practice models, developing hospital health system initiatives like outpatient pharmacies and specialty pharmacies within a health system. And then after 25 years at Einstein Medical Center, I decided to have a full circle moment and return to my roots. And I came back to the Temple Health System, and as a proud alumni, as the vice president and chief pharmacy officer at Temple Health. And I'm delighted to introduce to you my colleague, Dr. Jolly Patel, who will tell a bit about herself and her background.
Hi, so my name is Jolly Patel. I actually had no interest in pharmacy. I started off as a chemical engineering major. First day of engineering class, said this is not for me. And so I jumped around with, different majors from pre-med, pre-law, teaching, math. I ended up with a, bachelor's degree in biology from Drexel University. And after that, I started working at University of Penn in a research lab, and I worked with mice and rats, and we worked on endocrinology, diabetes, and obesity. And so, a quiz question for you is, what blockbuster drugs do you think I researched that was a precursor to the marketed drug? And that was basically the GLP-1 receptor antagonist. And those are drugs like Ozempic, Wegovy. So, popular drugs, but 20 plus years ago, it was just a thought in somebody's head. And eventually, then I decided to go to pharmacy school, and I still didn't want to be a pharmacist. I went to pharmacy school to go back into research so that I would have credentials to advance. And so all through my, 4 years of pharmacy school, I was like, nope, not going to be a pharmacist. Nope, I don't like it. And there was a rotation I did, and it was at the National Naval Medical Center. and it was my acute care rotation, and that's what made me fall in love with hospital pharmacy. And so my career pathway changed, and I decided to pursue a residency so that I could ensure that I would be in hospital pharmacy practice. I did my residency at Hahnemann University Hospital, and then I, started my career as a pharmacist after that. During that time, I also got my, Master's of Healthcare Administration at Western Governors University. Then next slide. So as you can see, I've been all over. I grew up in Texas, even though I have been in this area for quite some time. I, graduated undergrad here, residency here, worked here. I went back to Texas for my first position outside of my residency. And from there, went from staff pharmacist, clinical specialist, clinical coordinator, moved on somewhere else, manager, then director of pharmacy at various places. And then I ended up back in the Philadelphia area. I had been here previously and was always trying to come back. And so I ended up at Temple, and where I started as the senior director of pharmacy at Temple, Maine. And then I moved up to AVP of pharmacy operations. So you never know where your career takes you. So a little bit about the history of pharmacy. Philadelphia is the home of the first hospital pharmacy. And in the old days, it was known as apothecaries. So another quiz question: who established the first hospital pharmacy, and what is the name of it? And if you advance the next slide on the thing, you can see the answer, which would be Benjamin Franklin. And then the name of the hospital, if advance one more, is Pennsylvania Hospital. And then another quiz question, and if you advance one more, what infamous American Revolutionary trader was a pharmacist? Benedict Arnold. So in the old days, in the early parts of pharmacy, they did residencies, which was very different than the residencies that we do now. And in exchange for room and board, the students were working in the apothecaries, but medicine and pharmacy was very much closely intertwined. So pharmacists could evaluate, diagnose, prescribe, and prepare remedies. And they did compounding, and it was from raw materials. And then the counseling that you see that at your retail pharmacies, they did it in the colonial times. And they were doing house calls, performing surgery. Sometimes they even acted as midwives. And our first drug shortage in America was when we went and had a war with England. American Revolution ceased shipping from England. So that was the first time we had to deal with drug shortages, which is very common nowadays for hospital pharmacies, retail pharmacies. And then the first licensed pharmacist is in Louis Delfeayo. He opened a pharmacy in New Orleans, and he based his medications on Louisiana voodoo culture with roots in West Africa, and it was furthered by Haitian immigrants. So that's where we started, and here we are at Temple School of Pharmacy, opened in 1901. They had the first pharmacy degree granted in 1905. The classes were in the evening for 4 years at Samaritan Hospital, which is now Temple University Hospital. And then if you look to, if you go back, I have a picture of Deb. I did a little research. So I found Deb's class picture in the yearbook.
So Jolly actually has a side degree or a gig in forensics, and she was able to find my picture from a very long time ago. So, but that's the nice thing about Temple School of Pharmacy. You are part of the archives after you've attended. So I was pleasantly surprised that she was able to locate my colleagues and my class picture.
So we'll now delve into the pharmacy services at Temple Health. So this is all of our 7 campuses, including the new one that will be opening, which is Women's and Family. And if you advance the next slide, it's a little summary of all of our hospitals. Temple University Hospital, which is the main campus. That's our academic medical teaching institution, level 1 trauma. It's a burn center. You have Jeans Campus, which is about 164 community hospital with the focus on bone marrow transplant. Chestnut Hill is a 148-bed community-based inpatient and outpatient facility, and that's our newest acquired that we did least recently. Fox Chase Cancer Center, it's an NCI designated comprehensive cancer center. Episcopal Campus is where most of our behavioral health is, done, and it's in the Kensington neighborhood. and Northeastern campus. That is our ambulatory practice site, and that is located in the Port Richmond neighborhood. And soon we'll be opening our women and family campus, which will be about 50 beds. Next slide. This is our picture of our leadership teams. It's not all of us. This is some of us. And we're spread out throughout our 7 hospitals, 3 retail pharmacies, and specialty pharmacy. So on this day, that was who our leadership team was. So what do pharmacists do? There's so many roles. You can be a staff pharmacist. You know the retail model. We have a retail pharmacist. There's the clinical staff pharmacist. You have a clinical specialist. We can focus on medication safety. We have ambulatory care medication therapy management pharmacist, otherwise known as MTM. You can be the director of pharmacy. You can be a manager. You can be a supervisor. You can be involved in diversion and informatics. You can be involved in the electronic health record pharmacy support team. And basically that's our EHR and how they bill the medication orders, how they bill the order sets, any labs. And so we have pharmacists heavily involved in that. And then at Temple, we have AVPs and then CPO and VP. Throughout the roles of the pharmacist, you have your dispensing pharmacist where they're doing medication preparation, medication verification. They are basically, that's your dispensing of the medications to the patient, whether it's at retail or if you're in the hospital, it goes to the various units. Your clinical pharmacists, they could be on your interdisciplinary patient care teams. They'll round with doctors, nurses, patient care, transport, case management, respiratory, and you're interacting directly with patients. You have your clinical specialist pharmacists. They have a defined expertise in a special area. So just like doctors, where they can specialize in critical care, transplant, pulmonary medications, they could do oncology, infectious disease. We have those same specialties. And so those are what we call our clin specs, but they are the clinical specialist pharmacists that are focused on specific disease states. You have your integrated pharmacists where they're doing both dispensing and clinical roles. And that could be like your MTM pharmacist. And then you have the administrative pharmacists where that's like people like where Deb and I, we're now in that role. And we're dealing with, elevating pharmacy practice, the regulations, the laws, dealing with HR issues, and then basically leading the pharmacy team. Throughout all this is the whole medication management process, and regulatory agencies and the Board of Pharmacy require this as a standard. So pharmacists are integral to the entire medication, pathway, whether it's planning what medications we have, so, buying it, where we store it, how we store it, making sure that the medications have integrity, the transcription of those medications and the prescribing, monitoring how the doctors are doing the prescribing and making sure it meets the dosing and monitoring parameters. When we prepare it, and we're doing compounding in the IV rooms, or you could be doing oral compounding, doing unit dose packaging. And so then after that, we dispense it, whether it's directly to a patient or it goes to automation into some machines called like Pyxis or Omnicell, where a nurse can retrieve that medication. And then that's how the nurse gets it to the patient. Then we could be involved in administration, such as your vaccination clinics. A lot of pharmacists during COVID, that's where we stepped up. And that's where they saw that the pharmacists can be, an integral part of the team in getting vaccinations out to the general public. We're also involved in monitoring. So like we can do warfarin, monitoring or antibiotic monitoring based on therapeutic drug levels, and then making adjustments to the dose that are, specific to that patient. And then just evaluating the entire treatment plan. If maybe one medication isn't working, recommending another medication, or the drug interactions, you start a new medication, and then will that interact with an old medication that the patient is on? And so making recommendations and changes to that. So it's throughout the whole medication process. And this goes into more of like the individual things of your role as a pharmacist when we're planning, prescribing, administering, dispensing, monitoring, evaluation, and preparing. We are basically crucial and touch many points in many disciplines, whether it's physicians, nurses, respiratory, radiology. We have, radiopharmaceuticals, and so are basically the, keepers of the standards for anything that is a medication. And what do our pharmacists do at Temple University Hospital? We make changes to medications, the doses based upon patient's kidney function. So if you have some, renal function issues, then you might need some adjustments. So our pharmacists are able to do that independently without having to contact a doctor. We're monitoring the effectiveness of medications by monitoring those therapeutic levels. We convert medications from IV to oral to get the patient out, ready for discharge. We're looking at medication route mismatch, which what that means is like if the medication is supposed to be PO, but it's somehow, enter as IV, we're catching those kind of errors. We make drug changes based on what we have in our formulary. And so, a doctor could prescribe one thing, but we don't carry that in the hospital. So then we make changes based on what we carry. We're dosing antibiotics based on drug levels. We're ensuring that antibiotics are not overprescribed, and making sure that they're within, days of therapy, or even just sometimes we don't need the antibiotics. We're doing HIV medication monitoring, and we're ensuring that patients are on the right medications when they're going through various levels of hospital care and at discharge. So what they get at the ED could be different than what they need in the ICU versus what they need when they're going now from ICU to med surg, and then what they're getting ready to leave when they're going home. So we're involved in all of these phases of care for the hospital patient. We have specialized roles in pharmacy. We have medication safety, where they're basically looking at the effectiveness of our medications, ways to improve it, making sure that they're safely dispensed, prepared. What could potentially cause an error, whether it's at the pharmacy, whether it's the doctor, whether it's the nurse. We have roles in informatics. They're looking at ways to use our, systems, our, electronic systems, where it's the machines or it's the electronic health record, how to improve that. We have involvement in investigational drug studies. So we have, two pharmacists and a technician involved in this. And so they're preparing that, looking at the studies, making sure that the patient is, placebo controlled and it's blinding. So they're involved in various clinical studies in our hospital. We have pharmacists that are involved in the operations of the pharmacy, basically making sure, the drug is getting out, preparing the schedule, doing payroll, the things that, the operations of the pharmacy to keep it going. We have our clinical team where they're, making rounds with physicians and the providers, and they're making recommendations. And then we have our administration team.
So I'm going to tell you a little bit about how students start their careers through the Temple University School of Pharmacy. One of the huge advantages of going to Temple School of Pharmacy is that you have the ability to interface with the hospital, the Temple Hospital, and the Temple Health System as you progress in your various stages of your academic career. Initially, when you come on board, you start off as an introductory pharmacy practice experience. These are your early years of pharmacy school. And in those early years, you're learning some of the foundation knowledge and education of the pharmacy school program. You also have to become familiar with healthcare in general. You have to learn how to read a medical chart and interact as a healthcare professional. So that's referred to as IPPY. And Temple University School of Pharmacy will give you some introductory rotations where you kind of settle in with the whole concept of being a healthcare professional initially. And as you progress in your curriculum, you then become much more advanced, and you're referred to as an APPE, an Advanced Pharmacy Practice Experience student. And that's where you're more focused on actually learning the art of pharmacy, all the aspects of clinical pharmacy, and being a professional pharmacist. So it's much more focused in your specific pharmacy practice role. And you will have much more robust rotations throughout your time at Temple School of Pharmacy. And you also get the benefit, if you are at Temple School of Pharmacy, to do rotations actually at the Temple Health System. After you complete your IPB and APPE and you actually graduated from pharmacy school successfully, which most Temple University students do achieve that end result, I'm proud to say, you then have the ability to do what's known as a postgraduate years of training. Those are known as PGY1 and PGY2. Those PGY1 and 2 postgraduate years really refines you to being an excellent pharmacist, and they're known as residencies. So when you're a resident, that's post-graduation, and then while you're actually going through the entire School of Pharmacy, you're referred to as a student intern, and that you can also do actual practical work in a pharmacy, whether it's a retail or a hospital pharmacy. You can get experiential training actually doing various aspects of pharmacy under the supervision of a pharmacist. So this is the pathway of your academic training and learning. And then on the next slide, the outcome of all of that. I should also mention that while you're going through pharmacy school, you will be doing various rotations in various areas of pharmacy practice. So you will probably spend some time, learning clinical pharmacy, where you will actually work closely with other professional peer groups like physicians, residents, nurses, and other pharmacists. If you do your rotations in a hospital, you will learn how to staff and how to perform pharmacy practice. Those are known as institutional rotations because they're in an academic setting and more or less in a healthcare setting. And most of the experience in a healthcare organization is with inpatients, but recently there's been a lot more activity happening in the ambulatory care setting. This is referred to as outpatient pharmacy practice. You can also do your outpatient experience in a different environment. You could do outpatient pharmacy practice rotations in a retail pharmacy, in a commercial pharmacy. So there's a lot of different opportunities in this area. You can also do rotations in pharmaceutical company. And then with the development of the computers, there's much more opportunity to do roles in informatics. So in the area of informatics, you will be involved in developing clinical pathways, making sure that architecture is in the electronic healthcare record. There's a lot happening in this space. This is a hot area with artificial intelligence. Informatics has a large part of pharmacy practice with automation and computerization and decentralized access to medications throughout the hospital setting. This has become a much more robust area of practice. And then there's specialized roles and rotations involving investigational drug studies. If you're in an academic teaching hospital, you will be able to experience medications that are not even approved on the market yet, but are in that research phase. And you'll interact with committees like investigational research boards. So this is a very exciting area as well. And then finally, after you've been doing many of these areas, there's opportunities for you to learn about the management of a pharmacy practice setting. There's a lot that goes into operating a pharmacy. You have to make sure, you have staffing and you have policies and procedures, and you have various systems to manage, the actual, 24 hours of pharmacy practice. In our organization, we have been very fortunate in that we host well over 200 IPPY and APPY students each and every year. They come from, Temple University School of Pharmacy to many different campuses within our health system. And we are directly involved in shaping your practical learning experiences. So we take great pride in being able to welcome you at our hospitals and, teach you some practical experiences so that you can really test drive your knowledge and training from the School of Pharmacy in a real patient setting. The pharmacy residency program became very popular, I guess, probably about 25 years ago. It's a postgraduate training that is really an investment in your career ladder as a pharmacist. What you gain in that 1 or 2 years of postgraduate education is equivalent to 3 years in the and you have much more intense specific year. Usually the first year of a residency is a general training where you learn general medicine, general pharmacy.
Dr. Patel, do
Oh,
you mind
I'm sorry.
stepping in
Yeah,
if
I'm
you will?
here. I'm
All
back.
right. All
Sorry.
right. Thank you so much. No, all good. Thank you so much.
Then you can do a specialized residency program in a specific area of practice like transplantation or infectious diseases. And there's a multitude of PGY2 experiences, but this really differentiates you as a pharmacist in practice if you do these residency programs. And it will really enhance your ability to obtain a very coveted role in the profession of pharmacy if you're willing to invest in these programs. And I don't know the percentage of students today that do residency, but I would think it's a large number, at least for the PGY1 residency. And it continues to grow each and every year. And the
I texted her.
Thank you. We apologize for the technical difficulties. We love tech when it works. It is definitely a double-edged sword. To our guests, we'll keep going in just a moment, so bear with us. And thank you to you all for joining us this evening. Definitely great information so far. One thing that I definitely love about my role is that I always get to learn something new, just new information about the field and growing roles within the career. We always say the pharmacy countertops and beyond. And as you can see, the role of the pharmacist is definitely at the countertops and beyond. So as you all continue to think about the roles that you want to go into after matriculating through the program, just think about this presentation as our guests have tapped into with us thus far this evening. There are so many different areas, and the chat will be open throughout this session. And as we finish up the presentation, you'll have an opportunity either to take yourself off mute or to just type your questions in the chat so that you can, figure out what, some steps or some, mentorship that may help you as you navigate your journey into becoming a future pharmacist. It looks like Dr. Hauser is back, so we will proceed.
I'm so sorry that I'm having some type of technical difficulty, but I could tell you that
It
as a
is A-OK. We hear you loud and
okay.
clear, so you are good to go, and we are back. Right, we can pick up where we left off on the pharmacy residency program. So you're good to go.
So I definitely welcome any questions you might have about the pharmacy practice model, the various stages of pharmacy career development. Um, I encourage you to ask any questions you may have about Temple University School of Pharmacy's program, what it's like to work at the hospital. We definitely would like to hear from you as well in this presentation. So please feel free to ask any questions you may have that we can answer. This is an example of our pharmacy practice residents and the residency directors at Temple University Hospital. You have Dr. Jamie Gray. She oversees the PGY1 residency program. And you can see here we have a PGY2 and PGY2 program. We do solid organ transplant as well as infectious diseases. We have one of the longest standing pharmacy residency programs in the country. I think we might have one of the original pharmacy residency programs in America. Our program goes back, I believe 1960s. So we have a solid pharmacy residency program at Temple University Hospital, long-standing. We actually just got reaccredited. So we are a strong fundamental program that's been in existence for many years. And over the course of those years, we have graduated like hundreds of successful pharmacy residents who've gone on to have very successful careers in pharmacy practice. We have our contact information for those of you that would like to reach out to us after this presentation. If you have questions, we would be happy to assist you in any way that we can. Sometimes you don't think of things immediately, but something might pop into your head after the presentation, or maybe you just want to visit the hospital or learn about career opportunities. We also have a large program for student interns throughout your pharmacy practice. Academic training. There's opportunities for you to actually work in a pharmacy in the hospital. So we encourage you to apply to our positions. They're on the Temple Careers webpage. Or you could just reach out to us or send us your CV. And, we usually have openings and opportunities somewhere throughout our health system. And it's an opportunity for you to get more hands-on learning and training. So we encourage you to be in contact with us if you would like to meet us or learn more about the various aspects of practice. We would be happy to talk to you.
I know Temple Health is a huge health system that does help educate our students. And I know that you mentioned it's also a site that some of the pharmacy students are able to work as an intern there while they're in pharmacy school. Can you just, I guess for the people that are listening, could you just talk a little bit about what student pharmacists would and could do, either if they're doing one of their rotations or as like an intern in the hospital?
So for the interns in the hospital, that they basically learn how to prepare the drug. So we'll teach them in central pharmacy, basically, which is your oral medications and preparing that for dispensing, but then also our IV compounding. And so they will help prepare the IV medications and learn the aseptic technique. They will go to the Pyxis machines and fill the machines there. So they're learning all the steps in basically getting the medication to the patient or to the nurse. If they're in the retail pharmacies, they could be helping, fill the scripts that the patients are bringing for either for a fill or from a discharge bed, bed planning. And so the provider is saying, well, this, the patient needs this medication to go home. And so that will go to our retail pharmacy. And so interns working there, they would be helping in that process. As far as rotations, it depends on the rotation they're doing. Like I have a management rotation, so they're going to help me on various activities. If I'm in budget season, which is right now, they would, learn how to prepare a budget. I would have them, go with my managers and my supervisors and learn how to do a schedule, how to do payroll. They, might have to participate in an interview process because, that is part of the management is, interviewing people. I typically don't let them sit in on the firings. That's to protect, our employees' confidentiality. But I do involve them in the interviews to see what it feels like to be on the other side. They might help us with a question that when we present information to our, executive team, they ask us to look into something. And so then we need to look up how those medications are being utilized. And so they're doing research for us to see, if the medication, if there was a med error, is there ways to improve the utilization of that medication, doing a cost analysis. Should we even carry that medication? Is it, clinical versus cost effective, and that's how we basically determine do we carry these medications in the hospital, because it's very different from retail where you're going to carry whatever the doctor prescribes. In the hospital, we can't carry every drug that's out there, so we have to be selective and mindful of what is going to first fit our patient population. So what we carry at Temple, Maine may not be what we carry at our Chestnut Hill Hospital because that's more community based. Your general care versus Temple, Maine is, that's the level 1 trauma. That's got transplant. That's got, our stroke, our burn. So our medications are going to be different. So our students are involved in various activities. It just depends on the rotation.
Also, when you come into your rotations, you actually learn how to be a professional pharmacist. You develop leadership skills as well, how to carry yourself, how to do presentations, how to, budget your time effectively, how to be planning and being prepared as a leader in healthcare. So you learn a lot of these other important skills so that you can be successful in pharmacy practice. It depends on the rotation in terms of what you'll actually do. As an intern, you'll get to see the day-to-day operations. So I think it's an excellent experience to actually be in the environment that you're going to be in the future. And you're going to learn a lot. You're going to be participating in rounding and committees in the entire structure of the organization. You will have touch points there. You'll do projects. You'll do a lot of learning extensively. It's really going to be based on what you put into it. Also, if you are involved and you're proactive, you'll see and do more, and you'll learn more. I noticed there's a question in the chat about insights on the percentage of graduates who secure residencies. So that's a good question, actually. And I always tell people, in terms of residencies, you have to follow the rule of 3. So what I mean by that is you need to apply for as many programs as you possibly can. You don't want to limit yourself to so few, because if you apply to, let's say, 10 programs or 10 to 12 programs, a third of those programs might grant you an interview. So if you apply to 10, maybe you'll get 3 interviews. And then a third of those interviews will result in a match or an opportunity to land a position as a resident. So I think it depends on how many programs you apply to. It's a competitive process. If you're very focused on a specific program and you limit yourself to only 1 or 2 applications, you might not achieve the result of a residency success match because you limited yourself greatly. It's in your best interest to be open-minded and to approach it with a wider net and apply to more programs, knowing that you're only going to hear back from maybe a third of those programs for an actual interview, and then a third of those programs will match you, and then you'll get the program. So I think you need to be flexible, open-minded. It might not be exactly what you want to do specifically, but I think the more open you are to the experience, the greater a chance you will have of landing a residency program. So I encourage you to do that and not be overly narrow in in your selection of the residencies themselves?
And then I would just like to comment, so for like Temple University School of Pharmacy students, in 2023, 80% of our students that were interested in residency programs secured a position. And then in our graduates of 2024, I think it's like about 74% of our students that were interested in residency positions were able to secure one. So I would say somewhere between 25 and 30% of the graduating class are interested in going into residency. And the ones that are not, they'll either get positions in hospitals, community pharmacy, or some of them will go into positions in the pharmaceutical industry and then other different paths of pharmacy. So Miriam, I hope between Dr. Hauser and I, we were able to answer that question for you.
Um, I'll ask, how important was mentorship throughout your early career paths, leading, throughout to where you are now? And how did you take advantage or navigate what mentorship looked like, and how did it change throughout your professional career?
I can tell you, I didn't get a mentor. I was usually in a position of trial by fire, and so I had to learn as I got into various positions. And so that is the one thing that, though, in the people that I lead, that I want to give to them what I didn't have, is being that mentor that I didn't have.
So, because I graduated decades ago, I was very fortunate in that I did have some amazing mentors. So, I actually worked early in my career with another Temple School of Pharmacy graduate. She actually was featured on your website a couple months ago. She turned 100 years old. Her name was Anne Perron. Anne Perron went to pharmacy school at Temple during World War II. She was one of the first female pharmacists from the School of Pharmacy. And she had the opportunity to become a pharmacist because many of the males were experiencing World War II. And she actually was my mentor. And she was an excellent pharmacist. I learned the importance of accuracy and safety and checking and just the art of compounding medications in a safe manner. She was really a fine pharmacist. She was articulate. She knew how to speak really well, answer drug information questions. This was pre-internet, so you can imagine what it was like to answer drug information back in the day. But she was an excellent role model for me, and then I got to see somebody who, it was not common, when I was in pharmacy school to see pharmacists, that were experienced and had achieved, pharmacy school, she actually graduated like in the 1940s. So she was a remarkable role leader for me. And then eventually, I had many other mentors along the way, and I learned a lot about, just about operations of a pharmacy. I really learned different kinds of things from different kinds of people. And it was a really wonderful time and era of pharmacy. Just, experiencing the rapid growth of pharmacy. I got to see like pharmacy take off, like residency programs starting, clinical pharmacy roles, starting. So it was really exciting to be part of that. That part of my career early in the day. Just seeing how much of an emphasis there was on pharmacists in the healthcare setting, and just watching, that growth. And it happened, I guess, in the course of like 10 years where it really took off. And it was a very exciting time to be in pharmacy. So I was fortunate. And then I guess in this point of my career, I want to mentor others and I want to give back to the profession. And it's probably one of the main reasons I returned to Temple. I'm really grateful for my experience at Temple School of Pharmacy. And I look at this part of my career, I would like to, give something back to the school, to the hospital. I'm really fortunate. I had an excellent education, and I like to give back and show others the way for a successful career in pharmacy.
I know we went over like all the different or some of the various areas that pharmacists are working in specifically at the hospital. So what are some of the, I guess, areas of interest you had that you were able to kind of fuse into your role as a pharmacist? So sometimes you may have an interest in writing or you may have an interest in math. How were you able to incorporate that in your role as a pharmacist, if you were able to incorporate that into your role as a pharmacist throughout your career?
I came from a research background, and being in whether it's my clinical, years as a clinical pharmacist, clinical coordinator, leading a clinical team, and now as director or whatever, I do a lot of data analysis. And so and Deb knows it. I just sit there and would count, crunch out numbers all day long if that's all I could do. I like that. I enjoy it. And so that research background is still in the, back of my head, and I'm able to use it, whether it's looking at, where are we seeing our growth, or, on a clinical study where, the standard deviation versus, that, right. So all of that stuff is still being used for my previous career.
So I'm really fortunate to work with Jolly because she is the person who does the data analysis and I'm the strategist. I have like a vision about where could pharmacy go? What could we be doing next? What could we be building? I want to build new practice models. I want to create new opportunities for pharmacists to be relevant to patients and to improve their care. So Jolly will do analysis and she'll do data opportunities and reviews, and I'll be like, Jolly, here's some data. What do you think of this? Can you make this pretty? Can you develop this concept that I'm having, whether it's to build a new pharmacy program, such as a new retail pharmacy or a home infusion program, or a variety of things that have come up day to day. So I think having somebody who is data driven will help you build out new pharmacy structures, new programs. So I think it's important that you surround yourself with people that have different talents, so that together as a group you can really take your programs to the next level. You don't know everything yourself, but if you surround yourself with various people that have different talent, you can all work together as a cohesive team, and you can develop many new programs. Early in my career, I spent a lot of time in medication safety. I think the first like 10 years of my career, I did a lot of medication safety. Eventually, I got involved in developing pharmacy practice models. You never know where pharmacy is going to take you. I actually developed a best practice in transitions of care early in 2010 to 12. Sometimes you get presented with a problem to solve in pharmacy, and you might have an idea or an intervention that can make a difference. You could study it, you could do an intervention, and you can make a change that can affect the art of pharmacy as a whole. So you never know where your career is going to take you. You should remember this though. You should try as you go throughout your career to give back to your profession. Share what you know with others, and that to me is one of your greatest accomplishments as a pharmacist, is when you're at the point in your career where you can share with others and you can surround yourself with people and help develop them so that they can be the future of the next pharmacy professionals. So you will have full circle moments like that in your career. You'll go through various phases, and you will love it. You will not regret being a pharmacist. It's a wonderful career, and there's so much benefit you can do for your patients. You can greatly improve their lives and their safety. So it's a vital profession, and it's very important, and you're very well respected as well.
Dr. Patel, this question is, I'm going to shift it to you. We had some latecomers, and you mentioned early in your introduction not being I guess, passionate or saying, no, pharmacy is not for me. So for anyone that is on this cusp or just not sure, what kind of I guess encouragement or steps would you give them to take to help kind of bring them to say pharmacy is right for you? Um, what helped you? And I think I think could help them to make that decision or just see that it is a pathway that is successful and it is broad.
Yeah, I would say like the model that most people associate pharmacists with is the retail model. And so learn to explore the other models. Come to the hospital. We'll show you what it is to be a pharmacist and, find that passion, that one thing. It may not be hospital pharmacy. You may not like it, right? And that's okay. But, explore the different things that a pharmacist can do so that you can say, that's the thing that's driving me. That's the thing I can do for the next 40, 50 years of my life, because it's your profession. It's not, something that you're going to be able to do for 40, 50 years and be miserable. You're not going to enjoy it. So you need to experience that firsthand. And so that's all I knew was the retail model. And I was like, nope, nope, nope. I can't do this. So I don't want to do pharmacy. You got to find that one thing that sparks your interest and then move with it. But the only way to do that is to like explore the different opportunities. Come shadow us for a day. If you don't want to do hospital pharmacy, come look at a different aspect of pharmacy. We've got, specialty pharmacy, the retail pharmacies, we've got MTM, we've got so many different models of pharmacy at Temple, but there's other pharmacy models that we may not have at Temple. So, explore those at the other sites and see what it is that, that one little spark, that's all it takes. And that's all it took for me, was that one little spark.
Thank you. Dr. Hauser, you mentioned, like being able to come back. And so can you just kind of speak on the flexibility of the role of a pharmacist and being able to navigate the different areas and kind of what helped to make uh, your your pathway flexible? What did you do along the way to make it so that you can transition and or come back?
I think the changes for pharmacists happened a lot during the COVID years. We were exhausted during those years. And I think during those years, I focused on self-preservation. I knew I had to be strong and I had to get through those years and I had to survive them. Um, I learned a lot from those years. I learned how to work remotely. Of course, I have my struggles this evening, but in general, I've been successful, periodically doing a Zoom, day or so. I definitely emphasize that you do self-care. It's a very fast-paced profession, pharmacy. Take care of yourself also. Allow yourself flexibility. You could work at a pharmacy as many hours as you like. You could go full-time, part-time, full, weekends, weekdays. The profession allows for that. It's whatever you need to do at the time you need to do it. There's many opportunities. I always say when one door closes, another one opens. You will find your place in pharmacy. And even someone like myself, after years of being in the same setting, and it's really hard to leave a place you've been at for a long time, but you'll have a moment where you might need to do that, and it's okay. It's okay to try something new. You will land softly somewhere else. You'll be successful. Be confident, know yourself, surround yourself with good people, strong professionals, and never lose sight of your purpose as a pharmacist. You're there to take care of patients. First and foremost, you need to make sure you don't ever forget that. That comes before anything. You're essentially a humble servant of the patient. Do not forget that. No matter where you go, where your career ends up taking you, you're there to service a patient. I think if you always stay centered and you know your purpose professionally, you will go far. The success will follow you. Just remember to never lose your way as a pharmacist and to be there for the patient. That's the most important thing.
Um, I Like I said, I'm always excited to just hear from those that are in the profession. It keeps me excited in my role as I get to meet and engage with prospective students. So, to our guests that were here with us this evening and those that will watch this later on, just take heed to what these amazing panelists had to say. If you all have any last minute questions, comments, you can drop them in the chat or take yourself off mute. If our panelists has any last final words to share before we close out tonight's session, please feel free to do so. But this was absolutely amazing. You shared from such a level of passion and experience and expertise that is just it's really honorable, and it just again it makes me still excited to just go out there and tell more students that pharmacy is right for them and they can find a place for them in pharmacy, as long as they have the passion for it. So again, thank you to you both.
Thank you for inviting us.
Thank you so much.
Absolutely.
It was
Thank
really
you both. That was fantastic.
Thank you very much for your time.
welcome. Please stay in touch. Feel free to reach out. Don't be shy.
Have a good night,
All right, have a
everyone.
good night.
All right,
Thank
bye.
you both.
Bye.